Well, good morning, everybody, or good evening, or good afternoon, depending on what part of the world you're tuning in from. Thank you very much for attending second episode of Larry Wilson Live. I'm here with Anthony Panepinto, and I've never actually, I think, got Anthony's title exactly right. All the expert panels, webinars that he's been on. But I think Anthony has been through 6 epidemics. This is his 7th, the pandemic, certainly the biggest one. He's been with Procter & Gamble for a number of years, and he was with DuPont before that. I introduced him once as Dr. Anthony Panepinto, but he corrected me and said, no, I have a doctorate in law, Larry. That's so it doesn't go by doctor. But also, don't get scared, though, ladies and gentlemen. Anthony is one of the reasons I wanted to do this show. David Bianco last week, I've interviewed him before, and I knew that he would be very interesting and engaging. But I have had a lot of conversations with Anthony about pandemic management and mismanagement on the expert panel webinars, 4 of those in North America. He's also joined me with HSE Global Series for North America, and also for the last series of 4 expert panel webinars, where we started getting into more difficult and persistent questions like, you know, recordable injuries have come down, but serious injuries and fatalities have not. Excellent business equals excellent safety, or excellent safety equals excellent business performance. But exactly why? Is it cause or correlation? So I've spent a lot of time with Anthony. This, though, is, I think, going to be probably one of the most interesting shows in terms of pandemic mismanagement. So Anthony, it's odd that I'm doing this because my dad started off so much saying, Larry, if you're introducing a subject, sometimes the very best thing to do is to just sort of give everybody a bit of the historical perspective, just so we can all sort of start the conversation at around the same spot. So maybe, Anthony, if you could, just a bit of background on yourself, and some of the educational credentials in terms of the epidemiology as well. But maybe just a bit of as you first start talking to me about the, SARS, SARS-1, SARS-2, Ebola, all of those sort of things. Just sort of bring us, if you can, sort of with yourself up to now.
Yeah, let me give you some foundations, and I think that'll help with context for the audience today. And thank you for inviting me to chat with everyone.
Oh, my pleasure, Anthony. My pleasure.
And I'll give a simple history, and there's a relevance why I'm giving a broad history. I grew up in Pittsburgh, Pennsylvania, the grandson of 4 Italian immigrants who worked in the steel industry. Grew up in Steeltown, USA. They had the foresight to send their children to college. My father was a lawyer. My mother became a surgeon, and so it's the perfect genetic mixture to create an industrial hygienist. So I've been interested in preventative medicine my whole life, you could say, and with every intent of going to medical school. And one day while on campus, I was actually interviewing for med school positions. I happened to walk by the School of Public Health, and there was an advertisement for a speech or a lecture on metals toxicity. So I signed up for it and went to it, and there was a professor named Michelle Shaper, wonderful person, brilliant woman, and a great teacher. And I heard her talking about this thing called industrial hygiene, and she did this great presentation on metals toxicity. And I thought to myself, wow, she framed industrial hygiene and preventive medicine in terms of being able to treat thousands of patients at a time, prevent health issues. And I got very excited. Much to the chagrin of my mother, I went home and said, hey, I registered to start in a master's program in public health and industrial hygiene. at the School of Public Health. I'm not going to go to medical school right now. Maybe I'll do that later. And here I am today after 35 years of practicing EH&S, and mostly in the industrial hygiene preventive medicine field. And Larry, I know your mom made some off-color remarks about your latest book. It can't be quite as bad as my mother went out and told people. She was fairly disappointed that she didn't get an MD out of me, and she told people that I cleaned factories at Procter and Gamble. So that's a bit of where I am, with that. But genuinely, I've spent most of my career doing various EH&S functions, starting with really getting interested in pulmonary toxicology. Worked at DuPont and as a study director in toxicology and industrial hygiene, playing in the area of fibers toxicology, immunotoxicology with that little substance called toluene diisocyanate that is highly allergenic, and then moving on to P&G and the more traditional EH&S roles, including special assignments in machine safety, as that legal framework emerged in Europe with the machinery directive. And so done a number of things. My current role is senior director of HS&E. I'm responsible for really the H, is the way I explain it. So I have industrial hygiene, competency for the company, preventive medicine, emergency response, and also regulatory and scientific affairs for our organization within the company. And I've done a lot, as Larry indicated, in terms of emergency planning, emergency response. I've worked, I led the Fukushima nuclear incident response. I've led preventive medicine responses when we had, hurricanes like Katrina, working with the startup teams, making sure they were safe as they went into triage and re-get plants started after those weather events. And I've been involved mostly in infection prevention since SARS. So I experienced SARS 1 in 2003, H1N1, the swine flu in 2009, and have given advice and risk communication throughout the 6 previous outbreaks or public health emergencies. And this one is really been different. And this all started for me on January 6th with my first call on SARS-CoV-2, which was really saying, okay, things are starting to turn upside down. We have people traveling all over the world. What's our contingency plan? And then it emerged into really planning for preventative medicine to keep our essential catalog sites open throughout the pandemic. So that's a little bit about my background and why you'll hear me speak passionately about preventive medicine and public health. To kick this off, what I want to do is take everybody back to a few, grounding things that I've learned and practiced throughout my career. And one
I was just going to ask you, Anthony. You said you told me, I think yesterday, like the biggest difference. Now, maybe I got this wrong. The biggest difference between this, the size, obviously, and the severity, but the amount of information, misinformation, real information that flooded. I don't even know if flooded is the right word. You said you've read 14,000 papers since this started, and then you said it's this much of it, Larry. That's all. Like, would you say that the biggest challenge or the biggest difference this time was the management? Because I remember both you and David, John, everybody had set up information lines so that your people could get some credible information, because it was just, would you say that was the biggest difference with this one, was the information overload, Anthony, and having to deal with all of that?
Absolutely. I mean, data democratization through the expansion of social media and the internet is the root cause from my perspective as a practitioner here. And the amount of misinformation, inconsistency in the public health services across states, across the globe, in fact. I mean, if you just take the definition of physical distancing, there are countries it was 6 feet or 2 meters, 1 meter, a half a meter, 3 feet, 2 feet. Everybody had a difference of opinion. And what I've told people is, I said, look, if someone's infected with this virus, or frankly, any respiratory virus, further away is better, closer is worse. And in the end, A mask serves as source prevention from distribution of respiratory viral particles by coughing, sneezing, singing, whatever mechanism you want to use. A mask works to slow that spread and slow that distance or decrease that distance. And that's what's really important. And I think that's, as it gets into, the line of fire. So let's talk about the line of fire with respiratory viruses. It really is understanding that, respiratory viruses since the plague transmit in three ways, and they're all a little different. So we have, airborne versus droplet. And you heard we spent 3 months arguing about airborne versus droplet.
What is the big difference in all of that? Just how far it can go, or how big the cloud is?
Exactly. So if you think about being close to someone who sneezes, you can see these big visible particles that might be laden with lots and lots of virus. And as that cloud spreads out, smaller particles transmit over a greater distance. So, again, a
Is it
mask.
almost as visible as your breath in the cold weather, Anthony?
Yeah.
I mean, if you think that's what I've been looking at, on the ski hill going, well, it's probably just about a meter beyond what you can see right there in terms of people exhaling. And certainly you can see that cloud well beyond the masks that the people are wearing.
Yeah.
Right. So, it's kind of we could do it in the videos and stuff. We could CG the virus in there so that we could make it visible for people. But this was my first sort of, you can certainly see the vapor cloud now in the cold, can't you? So about a meter from there, you wouldn't want to be any closer. That's for sure.
Yeah. And of course, if you have air moving behind you, that distance is greater. And there's lots of complicated dynamics that, I think are the relevant, simple messages that we need to deliver to people. And, as HS&E or any sort of preventive medicine specialist, is really, in a humble and empathetic way, having people understand, look, it is a continuum of exposure. It is an exposure issue. There is an invisible threat here, and there are key ways to prevent, that from getting into the line of fire. The other way viruses transmit, and to a lesser extent, and this is less important for SARS-CoV-2, has been proven by all the data that's out there, is surface transmission. So if I cough on a surface and you touch that surface and touch your face, how likely is it that you get a sufficient dose of virus in your mucous membranes to cause illness or cause you to become infectious? And then there's this whole issue of latent kind of exposure. If the viral particles land on surfaces, are they around for a long time? Can I pick them up on a railing 4 hours, 5 hours, 6 hours, 7 hours? The prevailing data on this particular virus demonstrates by all the cluster cases, and we talk about choirs and restaurants and public transport, it really is indicative that airborne transmission, whether you call it big particles, small particles, wherever they go, do you get an infectious dose by that? And so distancing is really important. Further away I am, the less likely exposed, and do I get to that infectious dose? Wearing a mask, it's not perfect, but it decreases the distance by which I transmit these particles. So again, if I come back to some foundations, the key to success, I think, and this for all the health and safety and environmental professionals, it really is, lending that empathetic ear to people when they ask you questions, whether it's about machine safety, whether it's about a hidden health hazard.
David Bianco was really big on that too. Remember, he was saying, you just, everybody's gonna be, tense. Try to be that, like, and you as well too. Trying to always be the calming voice in this as well too, right? To get the people to.
Absolutely.
There's a lot of stress that I think has been fueled. Well, there's a lot of stressful things that are real out there, and then there's a lot of this, counterproductive stress, I guess you could call it, for misinformation or different perceptions and beliefs that people have and things like that. Right to the folks who've. Think that the whole thing is a massive hoax, right? That some sort of global media, conspiracy. And you're like, well, that's a heck of a lot of coordination. I can tell you right now. I'm just pulling a few live TV shows and webinars together. I can't imagine taking over the whole communications network of the world. But nevertheless, Anthony, where we are right now, we've gone through an awful lot. If you were going to retrace, like sort of, to go forward from here, as a health and safety professional, probably one of the first things you'd want to do is just make sure that you do have a reliable communications network channel or chat line website, something where your folks can definitely get current, up-to-date, reliable information, because the misinformation hasn't stopped. But we've got a vaccine coming. We've heard all good news. What are you sort of telling the folks at Procter and Gamble now? Or, if I was a health and safety professional, sort of asking you, what should I be doing to get ready for the next 3-6 months? Or what's filling up your day these days, Anthony, in terms of getting your organization ready for the next phase or the next step?
Yeah, and if I think I'm going to break this up into shorter term and longer term. So if I think about this, what's next in the next 6 months, it really is still a lot of work, a lot of communication, keeping up with the data, and keeping up with what public health authorities are saying around the world about this virus, and keeping that in the front of people. So we reach out to people. Anybody can contact me on Teams 24 hours a day. I ask for 6 hours of return so that I can get some sleep. But I hated Teams before, Microsoft Teams before this pandemic. It's been a lifesaver. It lets me know what's going on in the worldwide, and across 157 sites. About 77,000 manufacturing associates can reach out to me. I can give responses in real time. If I don't know, I can go look things up and get back to them. That's been a wonderful tool. Having grand rounds for the site. So every other week, open mic on Wednesdays, I cover the current events, changes in policy. They can ask questions. So really stressing to people, be vigilant and keeping those lines of communication open, especially as more and more people come back to the workplace. Our plants, our manufacturing sites have been open and running as essential businesses since this started. They're well practiced at the habits and the practices of keeping themselves out of the line of fire, and those practices that are important, whether it be hand washing, mask wearing, changing your mask out frequently. I have this whole segment of people who've been working from home and who haven't had to practice those habits. So it really is preventing complacency creep for people who've been here, and bringing people into a whole new set of practices that they're not yet adapted to.
I called it drift instead of creep. I think it's I don't know if that's just if it's just semantics, but to try to make it a little little creep sounds a bit creepy, I think, sometimes, but the drift was exactly what it is. And you really see it here. Like during the summer, the drift was significant away from, people being concerned like they were in the spring. And now we're at a second rebound, wave here in Canada that's much more significant than the first one was. And you can warn people about complacency drift, right, Anthony? But that doesn't mean it stops it from happening to them. It's like when you go to a new culture, you sense that it's different, but you don't necessarily sense you're drifting into it until, one of your friends comes up to you and says, "Holy smokes, I think you've been in Hollywood a little too long, Larry." And kind of thing, you realize, wow, yeah, you have drifted a long way from home. One of the things you mentioned to me, Anthony, that I thought was really interesting was handling misinformation coming into you from your own company. I don't know what you said, the pseudo epidemiologists, or the pseudo experts.
I call them faux epidemiologists. Um,
But they like the, and how would a, like, because that's, you know, for you it's maybe easier, but how would a safety pro without as much technical background as yourself, how would they handle somebody coming in and, you know, misquoting a study or taking something out of context? Because I thought that, you know, the way you were handling that with those folks would be something really helpful for everybody, because that's got to be a difficult one when, you know, somebody comes brandishing in the paper, so to speak, and so what are you doing about, you know, and you're like, oh, for heaven's sakes, you know. And so take us through how you deal with those guys, if you could.
And it really is getting to those foundations of risk communication that I've learned over the 35 years I've been in practice. And it really gets to, so what's driving the fear or the logic behind, you know, waving something they found on Facebook at me and telling me that our protocols are horrible, given that we haven't had transmission in any workplace across the site since we've been working, and we've been really successful at keeping our operations running safely and keeping people safe. So it's the first, what's driving this? Is it a disdain for masks? Is it something that's happened in their own family? So really trying to understand that. And if you don't have the scientific background or the scientific data at your fingertips, there are three fundamental things that we go back to. It's been true of every plague. Viruses don't fly on their own. They're transmitted by people. They're essentially a bag of fat and protein that's filled with a sinister message. It's like a bad fortune cookie made of protein and fat. So how do we control the migration of that? Well, first thing, we go back to our foundations. If you're sick, you don't come to work. You know, I've had people criticize the fact that we're doing temperature screening. Well, I put it to this way. If you owned a business and you had 100 people, you had a factory, you had 100 people in your factory, and I took everybody's temperature, and everybody had contact with 10 people in your factory, and they walk in and I take a temperature and I send them home and send them to medical care, and they don't get in, and therefore they don't have contact in the workplace with those 10 people, that's a lower risk of having a problem with human capital. I mean, because as soon as I have to quarantine those 10 people, who do I have to keep my operation open? So if you don't do it for a practical preventive medicine public health aspect, you do it for a conservation of presence in the workplace and an ability to efficiently run your business. Because what are the risks of having 10 less people? I then have to move people around. I expand the scope of their work. I get them not only perhaps fatigued, I bring additional safety risk into it. So if I catch one person a month in a factory of 600 people who has a fever and tries to walk into the workplace, I've paid for my temperature screening because I have a vibrant, healthy workforce at work and I'm keeping my operations safe. So get back to those foundations with people. Viruses transmit in three ways: air, surface contamination, or latent surface contamination, or you hear the word fomite, which is not so relevant to this virus. But keep your hands clean, keep surfaces clean, wear a mask, stay away from each other. And again, the most important thing that we've done, and I think every company has done it in their own way, is getting the people to understand, look, if you've had any symptoms that are unusual to you in the past 7 days, we prefer you to stay at home. And if you can work from home, that's even better. If you can't, we don't want you to come in. And if you've had any contact with anybody known, presumed, suspected of having COVID in the past 14 days, we'd rather you stay at home. And let's have a conversation by phone about what that contact looked like and what your risk is, and a testing protocol. If the virus doesn't get into your workplace, then there's no risk. So it all starts with those foundations. And I think if you don't have the technical data to necessarily contradict something that someone throws in your face from Facebook, and one of my admins recently printed out an MD diploma from the University of Facebook School of Medicine for me and posted it in my cube here. But if you don't have the information right at your fingertips, again, get back to the foundations of preventative medicine. Keep the virus out of the workplace. If someone comes in, how do I detect it? What do I do if they're inside? I socially distance, I wear a mask, I keep surfaces clean. I have functional indoor air quality, driving ventilation. I mean, there's nothing special here, and we've made it so special. And I point out to people when they challenge me on masks, if masks didn't work, then why did physicians in the plague wear masks? Now they look like bird beaks and stuff like that. We can argue about the design. In the Spanish influenza, people wore masks. And since the American Civil War, field surgeons wore masks over their face to provide an antiseptic environment to doing surgery in the field. And I had people throw a paper at me saying, well, masks don't work in surgical suites. Look at this. And I'm like, in the modern surgical suite with the advanced ventilation and air cleaning systems, perhaps they're not as important, but we know from our foundational history that they do provide and serve a function to preventing me, if I'm wearing it, from infecting you.
Right.
And get back to those foundations and be, again, be empathetic. What's driving the risk? So I always tell my students when I teach risk communication, listen with an ear of empathy, understand people's fear and why they're coming at you. The second thing is use we terminology when you define the risk. Personalize the risk for everyone. It's not you're smoking, you shouldn't smoke. It's the bulk of people who smoke. This is what they've experienced. Right. And then I think it really is asking people to collaborate on the risk reduction, and it's translating your protocols into something meaningful and collaborative for people, and most importantly, be consistent in driving that message home. And that's what has crushed us for the last 9 months is politicians, bureaucrats, public health authorities, 3 feet, 6 feet, 2 feet, 1 feet, not explaining the basis for physical distancing, but just throwing numbers out there as if they're meaningless. And the other fact is it dignifies people.
Any bit of inconsistency out there is just all that anybody needs is a rationalization or as an excuse to just do what they wanted to do in the first place. Even the experts can't agree. So until they can get it together, I'm going to wear a mask, not wear a mask. But basically, in brackets is I'm going to do what I feel like doing, right? Because the experts can't agree. Instead of saying, well, wait a minute, if the experts can't agree, then the logical thing to do is to take the low risk strategy that's out there, because obviously, somebody isn't correct. So, let's pick the lesser of whatever evil might be out. But that's not human nature. Human nature is to want to do what you want to do and then look for reasons to kind of support it. And in things like this, like I said to you before, people willingly accept social distancing driving their car, and people that get closer than 6 feet to you get honked, it's not socially acceptable, right? We can do the same things. It's just that for reasons that are hard for me to accept, people 2 meters, like you were saying, it seems to be arm's length for some people, and they don't seem to treat it nearly as seriously as I think, it warrants right now. But I think that's also a bit of human nature as well. So the managing of information certainly is a big part of it. In terms of health, and I know you and I've talked about this too, Anthony, that health was never quite seen as being as prominent as perhaps safety or process safety. The plant blowing up obviously garners an awful lot of attention. But if we were looking, and I know this is, you have to have a fairly good set of glasses to look for a silver lining in all of this. Maybe a bronze lining might be apropos. But if we were looking for the good things that were coming out of this from a health and safety point of view, do you think it's more prominence for the H now and taking the H more seriously?
I think that's one unintended outcome of this. I look at my experience on this, and I've been through, previous public health crises, outbreaks, whatever you want to term those things. And I've practiced, having to convince people about invisible threats of other sorts, highly potent substances, radiation, and so forth. Most of my career, I think there's two things. One is I agree with you. There's going to be more focus and more prominence on health, and we're already seeing that in the total worker health movement, and even in SGE equity. There's discussions about going beyond the safety aspect of worrying about investment to the health aspect because of all the lost revenue created by this public health emergency, pandemic, whatever you want to call it. I think the other thing for each of us in the room that's an HS&E professional, this is a transformational situation for us. I mean, I had the ability to serve 107,000 P&Gers and their families during this, generating, safety guidance on how to travel by air and travel by car, and all sorts of things that I
definitely want to come back
to
to those two things too, Anthony, just before we close out, because there will be people traveling in the next month or so, one way or another. Like what you said yesterday to me, I thought was brilliant. Like, you're not supposed to be traveling, but if you were, don't. Here's the three things: the flush button in the washroom on the plane, the overhead bin compartment thing. Everybody touches that. And I think the third one you said was the lights and the ventilator one.
Yep. And again, this doesn't matter whether it's COVID, whether it's influenza, rhinovirus, and enterovirus, or any virus. I mean, we live amongst 300 cold producing viruses every winter. And we've focused on this one, but if I think about lost effort and sickness in people, and realize that even flu can lead to long-term effects in sensitive people, we should always be asking that question: what can we do to prevent seasonal related coughs, colds, flus? And I think this has raised awareness, but I think this is transformational. Every one of us who's practiced EH&S at some point in our career, we pulled the chit out of the hat and we were told, hey, it's your turn to put together the family safety calendar for the year. Okay. And January is fire protection.
Every safy engineer at P&G, they come in, this is your rite into passage, you were saying, right? You got to put together the home or the Christmas calendar, right?
And not to belittle that or say that doesn't have impact, it really is. This has been transformational because we have a situation, an event that's relevant to every single human being on the planet, and therefore our constituents, not only our workers in our workforce, not only our workers working from home, but their families, their children. And I think that's one of the great things that you've done, Larry, with the SafeStart COVID coloring book and the things that you've produced, is it makes it accessible to people to get an understanding of what they need to do. And I think we need to seize on that transformational opportunity as we move forward. And we can really use this as a platform to drive safety 24/7, drive worker health. I think
I thought so.
It's the silver lining.
I thought, like, for instance, that, people would like that. You obviously need some mental skills to deal with an invisible hazard. You're not going to get a reflex. You can't see it coming. So like you said before, folks in the office, like dealing with great big electric power companies. I remember talking to the expert panel in India, and he said, Larry, the folks that deal with electricity are doing so much better than our folks in admin and in the office, because they understand about thinking first, because you have to with electricity, right? But we don't have any of those mental skills at all with a lot of our other folks. So we're having much more instances of potential contacts and people having in the office environment than we actually are out in the field and on the production, with the production folks in generation. So I think that, when I try to produce this thing, hey, look, an extra layer of defense, mental skills to help you with an invisible hazard. One of the things that I think we were up against was exactly what you were saying, was that with so much information, misinformation out there, the focus became all on, the people, if you will, out protesting in crowds without masks on, like the very, whatever small percentage of that was that were doing sensational things versus the 90% of us that were just drifting naturally. Like, doesn't mean you're a bad human being. It just means you're normal. You can't see it, you can't feel it. Over time, you get less sensitive and less apprehensive. That's just the way your brain's hardwired. So I thought people would be a little more on the up. I mean, we did okay, but I thought people would be a little more on the uptake with wanting one more layer of defense. But I think I ran into the same problem you did, which was people were more willing to argue than they were to go protect themselves. It took more energy to argue than it would to put a mask on, but they'd still rather go do all of that than just, it's not that big a deal.
It goes back to February and March, though, inconsistency about masks. And I remind people, a mask is not a mask is not a mask. When people say masks don't work, I'm like, well, what mask are you talking about? And that starts a whole new conversation. We had the skill and the ability as a company to produce our own masks, where we have expertise, R&D expertise, in the company in non-woven technology. So we were able to produce and test our own masks. And so I have great confidence in understanding their performance, both from protecting the environment and protecting people on inhalation.
Right.
Which they're not perfect. But a bandana is something different than a non-woven mask, something different than a respirator. And again, we've seen this generalization of masks and confusion about masks and what is a mask and does it work and it doesn't work. And so you have to deal with those extremes and come back to the middle and say, look, it's imperfect protection for the people around you. It's imperfect protection for you if you're around other people, if you're all wearing them as a collective and you know each other's behaviors and you're adhering to good COVID behaviors when you're at home, there's no reason anybody should get infected in the workplace. And again, much too much has been made of positivity and testing. This will probably be, some people will challenge me on political correctness. What I look at is where my facilities are located, who's making up the people that are testing positive, who's making up the people that are going to the hospital, and what is hospital capacity. I own health and own preventive medicine for my community of practice. And so I've got to look at those counties or those locations where we draw our workforce from and make iterative conclusions, because frankly, everybody's measuring positivity differently around the world. In France, at the beginning of this, it was, hey, if you had a fever of 103 or over, it was COVID, but if it was less, it was flu. Okay, that's an arbitrary kind of point, but it's a definition. And that's why every day
we're funny when they went into lockdown and then they showed us the traffic jam in Paris for everybody in Paris trying to get out of Paris before the lockdown. I'm thinking, well, that's actually going to defeat the purpose of the lockdown, is it not? Like, if everybody that's potentially infected in the city just now goes out and gets everybody infected in the country, I can't see how the system actually wins at all of that. But the ironic part is that traffic in Paris is so bad that when you try to make it twice as bad, now nobody can move anywhere. So, they were probably safest in their cars for that period of time.
If I live in Georgia, I can't go see a movie, but all I need to do is drive to Tallahassee and I can go to a movie theater. I mean, this is part of the challenge and inconsistent messaging to people where,
Well, same here. You can literally drive out of your district that's red and go shop at, Black Friday shop at a place where it's not just big box stores and essential items, right? And so that's what everybody was doing, just driving an hour to go shopping. And, everybody on TV is saying, if you do all of this, you'll defeat the purpose. But we're at a sensitive spot, I think, with our culture in North America, Anthony. I don't want to be too much with my own opinion, but I can feel it even within myself going, I don't think anybody else should go home for Christmas, but I really want to see my mother. And I know I could probably do it safely. And, from what you were telling me about the plane itself isn't a high risk area. And I can see the wheels in my head trying to turn in the direction that I want to go. And I think that's probably what so many people are doing as well now too, right? And I think it's, I don't know if you've got any advice for us on that would be soothing or motivating. But if there was ever a time to sort of step back a bit and watch the wheels in your head move before you moved, this would be a good time to do it, because a lot of your behavior could be being driven by, I'm going to sound like a broken record, but rushing, frustration, fatigue, and complacency. You're tired of this. You're frustrated. You want to go do something, right? So it's a prime environment for making mistakes right now.
And it's the very reason that we've been putting advice, infographics and putting some, if you will, I'll say humorous, cartoons together for people to try and help. Look, we understand and are empathetic with the fatigue, the rushing, the complacency. Everyone's tired of this. Yesterday I got the question, hey, I can't wait until I get a vaccine. When are we going to get a vaccine? Because I can take my mask off. Well, wait, you're presuming the vaccine actually works to not only keep you safe from infection and disease, but also makes you not infectious to others. We won't know that for a while. So that's a huge leap to de-escalation of protocols that, hey, once 20% of the people get a vaccine, we can all take our masks off and we can all go, back to bars and do things. I think we have to be cautious about what the new normal looks like and when we get to it. But one of the reasons, Larry, back to your point, is we're developing if you are we're not advising you to have big parties at Christmas. We're not advising you to cross 7 state lines. But if you're going to do that, here are the safest ways to go about doing that. Everything from renting a car to driving to where you're thinking about where you're stopping based on what's happening in those communities to when you get there. And how to select, looking at how to really give a critical eye to selecting what hotel you're going to stay in based on their transparency and their cleaning and sanitization protocols. So just really trying to get people thinking on those triggers.
Well, the other thing you mentioned too about and what if something goes wrong? Like that, for instance, you said you had somebody, they had whatever, 17, 18 people over for Thanksgiving dinner. One of the in-laws turned out to be positive. So, they were asking you, okay, should everybody stay here? Should everybody go back home? They're from 6 different states, things like that. So, perhaps you could also talk about, like, if you were going to do something like this, do you now have a contingency plan if things go south?
Yeah,
like what will happen, for instance, if you do go home, but somebody gets positive? Now, how are you going to get back? How's your family going to get back? Who won't some of you stay? Do all, how's that all going to work? I mean, so, I think I don't want to be putting too many words in your mouth, Anthony, but if you're going to give people a sort of a 1, 2, 3, 4 or a 1, 2, 3 or 1, 2, 3, 4, 5 for traveling, even though we're all saying you shouldn't be traveling, which I think sounds a bit hypocritical, but nevertheless, could you kind of give us your sort of top recommendations or what you're telling your folks?
Your biggest risk is when you're indoors with people not living in your household in close proximity and not wearing a mask. That's when you're at your highest risk. So first step is to try and avoid those things. If you're traveling, make sure you have plenty of masks, make sure you have plenty of those common sense things. But getting into a car with multiple households, So a graphic I generated was, as a bit of humor for the grand rounds called P&G. If you can imagine, I said basically used a MiFi as an example of in 2019. This is what a super spreader event looked like. Is I could, a MiFi. This year it's a carload full of people.
Right.
And just trying to have people really understand, but foundationally, look, it's when you're in tight spaces. So if you're going to travel, go to Florida where outdoor restaurants are open, not to and I apologize, Larry, Saskatchewan where it's cold and you would have to eat indoors or freeze to death. Thinking about those things. So staying out of indoor spaces, wearing a mask, minimizing time and duration with people who you don't know their habits and practices. So look, if you have friends that are on the cautious side, you can probably engage safely for a limited time without masks and share a meal and in a home. But if you're mass gathering at a bar with 100 people you don't know, it's a risk-taking event. So we're just trying to give people some practical perspective because we know people are going to go.
Well, I also think you got to also be on your toes too. Like for instance, I thought at the mall, some of the stores had very serious protocols, and people were almost like right there when you walked in to kind of spray your hands, make sure you had a mask on, and very polite too. And there were other stores where it was a bit at the beginning, but then you could easily see there was no social distancing in the store. But where my wife and I really, if you will, kind of got scared, and that's why we left, was the food court. Because now you've got, like, they took half the chairs away so that people can't sit close, but they walk close, and they're walking by people that don't have masks on because they're eating and drinking, and like they could touch you when they walk by, and that's where I was like, this is the worst. Like you sort of get an overall sense that things are being controlled, but you've always got to be on your toes, I think, for each exact, like even when you walk into the washroom, for instance, right? There's a prime example of where you could easily open the door. There would be somebody not 2 meters, 6 feet apart, and potentially not wearing a mask. And that could be it right there, one breath, right? So like I was saying, you do need some mental skills to deal with an invisible hazard, because your mind is your best self-defense device, right? Right. That's very difficult to get people, because that's a lot. Mental skills take effort and work, and everybody just, they rather go argue with Anthony about the mask than actually worry about, look, I don't have good habit strength for wearing a mask, taking it off, watching where my hands have been when I take the mask off. For heaven's sakes, I could be infecting myself just putting the mask on and taking it off by not thinking about where my hands have been, right? And all the time, all I'm worried about is, how come I got to put this stupid mask on when I don't,
And that's why it's so important we get back to foundations. I mean, it's not like this is the first example of a virus, and it's one of the final points I make. I know we need to get on to questions. So
right.
Again,
there's so many questions coming. I know I'm trying to do both, Anthony, but again, I just like talking to you. So we'll get to the questions too. But I mean, to me, this denial thing has been a big problem. Like the drift was going to be bad enough. Like complacency, drift happens to everybody, especially over this has been almost a year now. Impossible not to become less fearful or apprehensive when stuff isn't in your face. But you'll never get anywhere with people doing stuff for themselves if they would much rather think that it's somebody else's problem that can be taken care of, and arguing about it and so on. So I found that, I think I've got a very valuable message. I just don't know how many deaf ears it fell on. That's all. Because like I said, people, it's easier to argue about things than it is to change, and to change your own habits and to do things that are inconvenient, like wearing masks and gloves and having hand sanitizer around with you. I mean, there's a tremendous potential for denial in all of that, right? And I'm young, and so what, and it's got all the perfect story, and look what happened. Almost every one of those things, almost every date you gave me for when things were going to happened within 3 days over the last 8 months since we started doing the panels.
And again, if we understand the transmission dynamics, which is really simple, given that there is this window with this particular virus and the way it's programmed of asymptomatic spread, there's about 48 hours between, day 4 since you've been infected and day 6, where you're probably tooling around, and it's going to vary in people. Don't hold me to that number, but that you're at your most risk to others because you're feeling pretty okay. And yeah, I might have the sniffles, but yeah, I know that I was at a bar and I know someone tested positive there, but that doesn't really apply to me. I wasn't next to them. There's lots of ways to do this, and so what we really have spent a lot of time doing is getting down to foundations with people about transmission dynamics, about latency periods, about when to go get tested, so that they really have an understanding and taking the complex and really breaking it down to a couple of simple facts.
Okay.
Again, whether it's Spanish flu, the Hong Kong flu in '69, whether it's measles, whether it's Lyme disease. I mean, viruses work on some principle basis if you want to give them a livelihood. There's some irrefutable things as to the way they have been programmed to work. And get back to those foundations is the only advice. I've taken a different tact because of the complexities of having 81 countries giving input, Facebook giving input, Google giving input, Twitter giving input, and God knows how many other voices that are out there. And I've taken the tact of going back to the foundational literature. And I have to be careful because remember, a lot of the literature is popping out quickly without being peer reviewed. There have been Lancet articles that the media ran with in February and March that have been retracted.
Right.
So you have to be a cautious user. And that's why I think, if you get back to those foundations of preventative medicine, don't come to work if you're sick. If you have any symptoms that are unusual to you, stay out of the workplace. If you've had contacts, wear a mask. We can talk about what a mask is and how efficient it is or not efficient it is. Stay away, keep your distance. Wash your hands, wash surfaces. I'm in a conference room here at P&G. When I'm done with this call, I'm going to put my mask back on and I'm going to sanitize my work area, even though I know at the end of the day, someone's going to come in and do another disinfection cycle, so that someone else can use this room tomorrow. It's about those common habits and practices that they'll prevent the cold, they'll prevent the flu, they'll prevent you from getting a stomach virus. It's all foundational public health prevention. And if we stick to that message, we as safety leaders can be transformational because this has relevance in the workplace and it has relevance to families of our constituents at home. And I think it's that constant message that we need to be consistent and deliberate with. And I think we have a great opportunity to turn safety 24/7 that's been handed to us by this unforeseen circumstance.
Yeah, I do too. I mean, I'm actually hopeful that it'll go. I know Keith Hole, you're listening somewhere out there. I saw you in the chat line. Gary Foote from ABB, I don't know if you're on, but I'm hopeful that this is also going to branch out into mental health as well too, and that the health and safety community, especially in North America, which I think is so far behind on mental health, or stepping up to the plate, if you will, on mental health. Remember, it was Keith actually, where a session where I found out that there was many people dying in the construction industry in the UK of suicide as there were from accidental injury. So, it's time to take the health part of safety seriously. Now, Anthony, we've got to answer this question because a lot of people have been saying, could you please take this question from Scott? So first of all, Scott, my apologies for Anthony and I rambling on and so long to get to this. The question, ladies and gentlemen, if you can't see it on your screen, although I think you can, is And this is to Anthony. I certainly hope, Scott, not to me, but what are your thoughts on the new CDC quarantine guidelines? Are you going to change your timing? So first of all, Anthony, maybe just tell us what the new CDC guidelines he's referring to are, and then you can tell us what you're going to do with them or not.
Yeah, and so the CDC recently changed their guideline for a close contact definition from, a accumulation of 15 minutes or more within 6 feet to even looking at consecutive contacts. So sorry about that. It was consecutive contacts. Now it's cumulative, meaning that in a 24-hour period, if I have 7 interactions close with people, someone turns up with a risk factor that equate to 15 minutes or more, then I have to go into a quarantine tracing tracking protocol.
Okay,
and yes,
okay.
And yes, we're making adjustments. And the reason I have a bit of a smile on my face is I probably have spent much of the last 2 weeks in lengthy meetings because, of course, there's a lot of emotion. Well, CDC didn't say it's a cumulative contact before. And I said, look, viruses are always cumulative contact. Okay. There's an infectious dose. And the way I broke this down for senior leadership is I said, let's assume the infectious dose of SARS-CoV-2 is 1,200 calories. Let's use calories.
Okay.
Whether I eat my 8 Twinkies for breakfast and hit my 1,200 calories or my infectious dose, or I eat my Twinkies every few hours to hit 1,200 calories, I still hit my infectious dose.
Right.
So it was
right.
my oversimplification using you. And now I was told by senior HR leadership I should take a vacation because I created a graph involving Twinkies as the example. But I think that's the issue. And so you can imagine, Scott, the churn that's creating, because before it was, well, 15 consecutive minutes is
Right.
much different than 15 cumulative minutes over the course of a day. So concerns are raising about that creating more context, because people thought, hey, after 15 minutes, it goes back to 0. Or if it's 14 minutes, 39 seconds, wow, I can breathe a sigh of relief because I'm not a close contact. And again, this is a great example of where the science would have always told us that it was cumulative, but because the written word and the protocol from the CDC had not said that before, people have been in shock and awe by this. And I've spent probably, again, too many hours in meetings with folks on that topic. But yes, we are modifying our protocols and we're working through that as we speak.
Wow. So many questions are coming in, Anthony. There was something about Michael. It's from Michael Wolf, and it's just his face masks are community protective equipment, not personal protective equipment. So, Michael, I think I know. It's not exactly a question. I don't know if you could fire one in that was a little more. But
wow. So Larry,
I like the idea of
I
like the idea of the community protection aspect, though. Go ahead, Annie.
Yeah. So think of it in 2 ways. And again, people say face masks.
Right.
So I having built and constructed and worked with experts in nonwoven technology to build our own masks here against FDA standards. I would say, what's your definition of a face mask? If it's like bath towel tied over your face, well, that's not what I'm using to provide both community protection and some level of personal protection to our cohorts at Procter & Gamble. And, again, this will sound harsh, but it's like, well, what is a face mask? Because they're not all created equal. You can buy electric masks. You can buy masks that claim to have nanotechnology in them. You can buy N95 respirators that are not respirators and are not masks, but they're something else. If it's not a respirator and it's not an ANSI, ASTM, or European Medical Directive approved mask, then it's an improvised mask. So it could be a bath towel, it could be a bandana, it could be all the things that we see from people. I need more definition, and that's one of the reasons we invested in constructing, and fortunately we had the capability to design, build, and manufacture or source masks where we pick the materials of construction. We know the breathability, we know the performance against particle challenges, and the reason we did that is we have 77,000 men and women working in essential supply chains that provide hygiene products to the world.
Right.
And I mean, I'm very lucky to work for a company that had that mastery. And that's the other, in kind of closing this one out, this is about collaboration. Every emergency response I've done in my career, it's about building collaboration. So one of the things that we did really well, and I encourage you to always do this, we had purchasing, we had R&D, we had HR, we had employee relations, we had government relations, we had communications people, medical people, HS&E people working in tandem to look at all the protocols, and that's how we got them implemented so quickly. And I found out whether it's SARS-CoV-2 or responding to Fukushima, I found friends in odd places, collaborators in college students in Japan who had capability on the ground to do radiation monitoring. And I was communicating with them, getting information because I couldn't be in 10 places in Japan at the same time.
Right.
So look for those collaborations and build your emergency response plan with an open mind about those collaborations. So,
okay, look, I'm gonna. Applies. I'll probably wearing cloth mask. Correct on boosties due to infected people, but since we don't know who's infected, in my workplace, it applies to everyone. Okay, yeah,
yep.
Exactly.
Yeah, that's the challenge. Is that again, CDC doesn't recognize much in the way of physical distancing or physical barriers or masks, even though we believe people, if you're wearing a mask and and a physical barrier is present, there's evidence to say that you're safer. It's not considered primary protection in a way that would bar or exempt from from meeting a close contact definition at this point in time.
Okay. Look, I should also say, everybody, I don't have COVID. I just typically, whenever I am on stage or I am on camera, even though I've been doing it for a long time, I usually get a bit of adrenaline and my nose runs a bit. So, but don't worry, I'm fine. And Anthony, I talked to you for hours, but our hour is up. So I'd like to, first of all, thank you very much for taking the time, not just today, but for all the expert panels and for all the advice you've given everybody over the last sort of six to 9 months, both with us on the panels and within your own organization. I don't know about you, everybody. 14,000 papers. Anthony's been working, 12, 14 hours a day, like you said, trying to take calls from everybody. So first of all, thanks very much for being on the show, Anthony, and for helping us with the webinars. But I'd also like to say thanks for what you do.
Thank you.
A lot of effort. Some of it's some of the stuff we worked on. Anthony's actually in one of the stories in the SafeStart COVID course. I don't think the guy who we got it as double did him justice, but we couldn't fly him around, so we had to make do. So I should also thank you for helping us out with that, Anthony. The next show, everybody, is going to be on December the 17th. It's going to be at noon Eastern, 9 a.m. Pacific. And the reason we're going an hour earlier is because Dr. Wada Ghanem from Dubai, he's with Emirates National Oil Company. But it was actually, Dr. Wada has been on the panels with Anthony and I, expert panels in North America, Europe, HSE, Global Series, as well as with GLC conferences in Europe. He's written 8 books, and we're going to be discussing human factors and process safety. But Wada was actually, I think, watching Larry King live some Friday night in Dubai and phoned me up on Saturday, and he asked me, have you ever seen Larry King live? And I said, well, of course, everybody has. He said, I think you should do Larry Wilson live. And so I wanted to start with David, and I wanted to talk with Anthony about COVID before Christmas, especially to, even though we're not supposed to travel, Anthony, if you were, here's how you can do it safely. But human factors in process safety, 9 a.m. Pacific, 12 noon Eastern on December 17th. Thank you very much, everybody, for attending. And Anthony, thank you so much again for all your help with all this. And look forward to seeing you on the next expert panel for North America. I think it's
thanks everyone. Thanks, Larry. And I want to give one shout out to my family for putting up with the all the reading and all the listening to my discussions about COVID. They've been without their support, I couldn't have gotten through 14,000 papers. So thank you.
Oh, well, yes, and I should be thanking mine too for putting up with all these 3 o'clock in the morning webinars. All right, everybody. We'll see you next time, December 17th, 9 a.m. Pacific, noon Eastern.
Stay well, everyone.
Bye-bye.
Bye.
Bye-bye.